Hello guys, Preventive Care News. I know I should have done that in the beginning of the year by January, but this winter quarter of 2026 was very busy. I haven't had one like that in a while. So now I am a little bit with a spring quarter, a little bit more flexible to do that. So let's go for it. So what happened at the second half of 2025? So we still need to report this, the graduation and the new students, graduation in June, new students in fall and September, and then activities that happen with our faculty, with our graduates, with our students in between. So those are the graduates. On my side, starting on the left, Tala Zukari, Suzanne Abul Nazar, Vivian Navarro, Princess Lisa Coffee. Princess Lisa Coffee. And then you have, besides Lisa, you have Dr. Medina and Dr. Palani. So this is the whole preventive care faculty and students. We have more people that graduated that year, but those are the ones that could make the graduation ceremony. Here we have Tala Zukari and Claudia Boafo, and they got the Preventive Care Awards. And if I am not wrong, they got the Glenn Blix Award that we give to top students when they are doing their research. This is the group of faculty. We used to sing during the hooding ceremony at Randall's Visitor Center. And we took a picture before we start the program. Here is just faculty during the baccalaureate ceremony in Loma Linda University Church. Just I'm going to mention names from my side. Dr. J.C. Belliard, Dr. Larry Beeson. Dr. Larry Beeson has been involved in preventive care intensively as the main biostatistician for the final projects and statistics analysis for the students' final projects. Then we have Dr. Seth Viafe, and Dr. Carl McClear. Dr. Carl McClear is the director of the HPL, doctoral in public health. And then Dr. Anna Nelson, who is now our academic dean in the School of Public Health. Some pictures we have some visitors there. If you've seen this picture here beside me, we have Dr. Edward Nathan, and he is from Malaysia. Now he is moving to the Philippines. He's a graduate in preventive care while I was a professor, so he was one of my students. He graduated maybe 2009, 2010, something like that. And then he graduated, and then he is also a physician in Asia, and he was working in a hospital in Malaysia, in Penang Adventist Hospital, and now he's the director of the Health Promotion Program, the Public Health Education Program in IAS, a university in the Philippines. Here is the first graduate that we have here, Suzanne Abul Nazar, and a picture with Dr. Hart and the Dean of the School of Public Health, Dr. Adam Arachiga. Here is Suzanne with her family. They are very happy. By the way, this is Susanna's husband. By the way, Susanna was pregnant during the graduation, and a few months after graduation, the baby was born. And I believe I have a picture of it. There you go. So he was crying, but he was happy. So here is um, a baby that was born in 2025, right after graduation, the new member of the Preventive Care family. Now we have Princess Lisa Coffee. Um, she is from the East Coast, and she came with her family just for this celebration. Now, through Lisa and Suzanne, and then Lisa's family that was there present to support her during this graduation ceremony. Vivian Navarro, she is from San Diego, and she graduated in the program. She is a registered dietitian also. By the way, Princess Lisa Coffee is also a registered dietitian. Here we have a picture with Vivian and her boyfriend. Then a picture of Lisa and a whole group of family and friends. By the way, I believe on the left side we have the director of SIMS. Lisa has been several mission trips with SIMS around the world. I mentioned in the other preventive care news that she went to Africa, maybe it was Kenya, I'm not sure, and then she went to Thailand. Tala Zukari, now a picture with the president and the dean of the school. Is Tala with her boyfriend, and then here is with the family. One more with the family and a little bit family and friends together. So let's move now from the graduates that left to the new ones that were arriving. Wong Chi Wing from Hong Kong. He is the director of the nutrition services for the Hong Kong Adventist Hospital in Hong Kong. By the way, he used to work with me when I was there in the year 2007, and now he is one of our students. We have two students from Hong Kong Adventist Hospital. One is Alan Siu, that is finishing this year, and then Wong Shi Wing, that is joining us in the fall 2025. And he is with Margaret and their daughter. I know Margaret. She was also a nurse in the hospital when I was working in Hong Kong, and I don't remember their daughter because she was very tiny when I was there. Orquídea Rodriguez from Commerce, California, is another one that joined the program last fall. Then Lucia Cloud is one from, she lives in Loma Linda. She works with SIMS. She is very into mission. And then she is another new student that enriched our family, preventive care family. Odunayo Talabi from Cumberland, Rhode Island. Very active guy, graduate from Harvard in the Master in Public Health, and already involving our preventive care research group and already submitting a paper with us and involving the Loma Linda Centenarian study. Dr. Richard John from Trinidad and Tobago is another student. When she entered in the program, we had 3 students from Trinidad and Tobago. Maria Jose Hummel from Salinas, California, is another registered dietitian that just started with us. She has intensive or extensive experience with community health and the promotion of plant-based diet programs and lifestyle to improve the health of the community. So here we have a group of guys. We have one more, I found one more picture. We have 9 new students. And on this part here, let me get the pen for the highlight. No, pen is not working today. Oh yeah. So this is Sandra Schmidt. She is the newest um, student in the program. By the way, she is originally from Brazil. We are happy to have her. And then she is in fact she is a dentist, and then she is joining the program with the idea to develop a lifestyle to prevent, to produce, to improve oral health. This is a list of students, and I felt that was interesting to share with you. We have 9 students that are working internationally, and then most of them are from their places there. And then we have 12 that I know graduates from preventive care belonging to the preventive care family that are working overseas in all different countries of the world. So it's important to notice that preventive care is, and it has an international flavor, and we really go to places. The first guy, James Atolabi, he was a graduate of the program when I started here. In 2007, he was already a graduate, and he used to have 2 clinics for weight management here in San Bernardino County. And then with the time, he was very successful with his clinics. And then with the time, he moved to Nigeria to be a provost of a university in Nigeria. And since then, he is working in that country. He is original from there, but he was an American citizen for many years and working here, and decided to go back. And just for you, just an illustration of the character of the or the passion for helping people, no matter where, around the world, around the country, around the California state. So let's report some of the activities during the year 2025 and 2000 and the year 2026. This is a health fair and lecture that we did at the Orange County um, Church. This guy here is called David Nguyen. David Nguyen, wherever he goes, he brings me together and my team. So let's go. We have several activities on the church. Here we have Melissa Klein on the left, and on the right we have Claudia Boafo that came to help with the health fair, doing health assessments and doing health coaching and doing lifestyle counseling for the participants. This is an interview that Ruben Shipuli, a recent graduate of the program, he just graduated last quarter, um, in the fall quarter. And then he was interviewed by Dr. Hart because Ruben has been involved with SIMS, Student for International Mission Services. The last time I talked to Ruben, and that's one important thing, he said that he is was kind of contracted with SIMS to develop a component of lifestyle in the mission trips that the organization developed in such a way that they will have an assessment, they will have prevention components in terms of exercise and diet. And Ruben, just graduated from preventive care, is going to be the guy that will start this for the SIMS program. Dr. Rwandala Gudo is a new acquisition in the School of Public Health. She came uh, also a graduate in preventive care many years ago. In fact, she is a graduate from the year 2008, if I'm not wrong, because I have a picture of her graduation in my office the first year that I was working here. And she is the new director for the Master in Public Health in Health Education and Wellness and the certificate of the health and wellness coach. We are glad to have her on the team. She is already a member of the Preventive Care Committee, and she will help us with. She is a faculty in the preventive care because two of courses that we have in preventive care are related to health coaching. And then we are happy to have welcome to Loma Linda School of Public Health and to Preventive Care, Dr. Rwandala Guto. This is from Rayanne Leal, another graduate of the program. She graduated in 2025. She is being a research fellow with the CDC. But the most important thing is that she just got the most important thing is that she just got the National Board of Public Health Examiners certified in public health, CPH. It's an honor to have our students progressing and getting the right certificates in their profession. Now we have Krista Lamont. Krista Lamont got her National Board of Health and Wellness Coaching, and we congratulate her. She is already a therapist, marriage and family therapist, and now she has another therapy certificate in health coach, if I can say that. Dr. Giselle Edwards from Trinidad got her diplomate from the American College of Lifestyle Medicine. And then, by the way, both Giselle Edwards and Jocelyn Pierre are from Trinidad. They are students from Trinidad. And then Jocelyn Pierre, he is a registered dietitian, also got a diplomate from the American College of Lifestyle Medicine. So we are happy that our graduates, I mean, Jocelyn was already graduated, and Giselle is a current student in the program. And we are happy to have our students and our graduates involved in the American College of Lifestyle Medicine. That is our college. I am a member founder of that. I was an ex-board member. We are involved. This is our college. This is our conference that they have yearly. And we recommend that every single student we're supposed to be members of the college. So let's review some of our publications. This is one publication by that we put Princess Lisa Coffee in charge. Her picture here. Lisa published that before she finished her paper, her own project in preventive care. This publication was being reviewed and reviewed and reviewed for at least 3 years before we published. And this publication was originally done in Hong Kong by this subject here, uh, Peter Chuck, Peter Chuck, a very good friend of mine in Hong Kong. He conducted the saliva study that they check the saliva pH of vegetarians and compared to non-vegetarians, and somehow the pH of vegetarians were more within the pH range of normality compared to non-vegetarians, and non-vegetarians have a little bit of an acidic pH. I put this picture here just because Peter just died uh, a few months after I was able to publish his paper. And it was a sad notice for us. He was a good friend. And Peter, and hopefully, um, well, happily, he saw his paper before he died, because he was the one that conducted a study about the saliva, and then he tried to publish by himself, was not able. Then he sent the paper to the Preventive Care Research Group. We reviewed the paper. We have dentists, we have masters in public health, we have epidemiologists and statisticians going over that paper over and over. We submit 2 times and we were not able to publish, and then finally we published. And was a few months before Peter died, we were able to send a copy of the publication to him. Preventive Care family has some of those dramas too. Here we have one publication that was done in the Adventist Health Study. This publication originally was by Senlu Padilla, and she was not able to publish. She submitted 1 time and was not accepted. And then we review it, and then we, with the Preventive Care Research Group, and publish in the Journal of Aging, Research, and Lifestyle. This is our preventive care, our current preventive care research group. By the way, we have uh, now we have 3 students, but we used to have 4 students. Sorry, now we have 4 students. We used to have 3 students there. And John Zajay, Deja Lofton, Odunayo Talabi, and Sitoya Mansell just joined us before I was able to make this picture, as Dr. Abel Alvarez already graduated in the program. Abel Alvarez is a physician and also a DrPH in preventive care, and he is working in a company in California. I believe he was working with Riverside County, if I'm not wrong. So we are very happy to announce that Linda Williams Silverbridge was able, Linda Silverbridges Williams. I don't forget names, but sometimes I change the order there. She was able to publish this uh, her article from her dissertation in the journal Health Science Reports. And we are very happy she was able to study the caregivers of Alzheimer's patients. And she figured out that caregivers have uh, the ones that have a better practice of exercise have a better quality of life. And then another publication that we did was from the student Micheline Vargas. This study was conducted 13 years ago, and then the student contacted us, and she sent her paper for the Preventive Care Research Group. We updated the literature, we changed the references, we changed the grammar, we changed the statistics, we fixed some of the terminologies, and then we were able to publish in our Curious Journal of Health Science, or Curious Journal of Medical Science. One of the authors of this article, the senior author, was Dr. Lee Berg. Dr. Lee Berg has been he is a preventive care graduate and has been a strong supporter of the program. I would say the program is still alive because of him, because about 5 years ago, 2019, we almost closed down the program because we didn't have enough students. And Dr. Lee suggested, hey, let's put this program online. And we put the program online and it boomed. We have 20, 30, today we have 33 students in the program and a few on leave of absence. And so, but Dr. Lee unfortunately died last year, and he was 80 and some years old, and we are very sad. He was my best friend in the School of Public Health, my best friend in the university at all, my best friend here, and he was my mentor. He helped me to find a job when I was a student, and so um, I would say, sad with the passing away of Dr. Lieber. Here is with one of our dissertation committees. This is Erin Burks. And on my side, we have Dr. Jerry Lee, uh, because this was another study done with the Adventist Health Study, mostly with the religion component of the Adventist Health Study. And Dr. Lee was the director of the biosocial, spiritual, I would say, cohort of the Advanced Health Study. This is a lecture done by Ruben Shipuli at Drayson Center. Ruben Shipuli and Claudia Boafo, and also Mareka Sawyer, have been very influenced at Drayson promoting the Blue Zone. And here we have an article that was presented by a report that featured their work there in Drayson Center. Marieka is a very good volunteer. She volunteered for health fairs. She volunteered for health assessments, for preventive care, and especially for the Drayson Center Office of Preventive Care, at least when I was the director. Now, Dr. Shipuli, that just graduated, he is the one that is the director of the Drayson Center Office of Preventive Care. Is still running there under um, Ruben, and also under Dr. Kimberly Knowlton, that is the director of the Drayson Center, and also a graduate from Preventive Care. You see that Preventive Care graduates are all around. In the university, we found them in the School of Allied Health. At least we have 3 graduates of Preventive Care in the School of Allied Health. We have Raja Abdabro, we have Kathy Ohms, and we have Carol Davis. And they are director of programs there. They are professionals in different programs in the School of Allied Health. And in the School of Public Health, we have some in the School of Medicine, School of Behavioral Health, and I'm not sure if we have in the School of Nursing, but we have all around preventive care specialists. So that is important for the new students. Some of you are listening to this and you are considering to apply for the program. It shows that many graduates go for academics, go for teaching in university, and especially in university like Dr. Rowan Goudot is now a hired person for the School of Public Health, a graduate from Preventive Care. Claudia Boafo organized this event for the students, and she did a lot of health coaching sessions and build up health assessments for the students. It was a very important event uh, conducted at the Dresden Center. Here is a seminar we conducted in Brazil. Um, and this is another prevention seminar that we did about cancer in the city that I go in south of Brazil. This is the graduation group. This is in a church, and the church has a health club, and then they invited me for this seminar. Here is one example of the certificate that we give to the participants of the seminar, cancer prevention seminar. Here is I'm very proud to find these books. I went to a bookstore, Adventist bookstore in the city of Porto Alegre, where I was born, in south of Brazil. I entered in the bookstore and I found these two books. Guess what? These two books were written by Don Hall. And Don Hall is another graduate of preventive care. So you see the reach of the program. Don Hall wrote the books in Brazil, in the United States in English, and this book was translated, who knows to how many other languages, but at least translated to Portuguese. And then the one on the left is that the advantages of the vegetarian diet, and the one on the right is clear, how to prevent and control diabetes. This is a lecture that I did, fasting for weight management, for the Mended Hearts Cardiac Health Support Group meeting. I am a kind of an official speaker for them, and every 2 or 3 months they call me and for me to talk again about some health issues for them. This is Lady Ann Cordero Patel, one of our students that is considering your help. If you are a Loma Linda student, please contact her or read the QR code here or contact me because she needs more students. She's conducting a research with students from Loma Linda, La Sierra, and Pacific Union College. Here is a lecture that Dr. Medina and Ruben Shipuli and Dr. Ruben Shipuli were invited to talk about pickleball and probably about the results, the study results that Ruben Shipuli got because his paper was on pickleball and health. And this was the Will Alexander Wholeness Series. This is another health sermon that I presented in the Loma Linda Victoria Church that is very close to our church, to our school here in Loma Linda. This is our health symposium. We just got the copies and videos, a video link for the sessions, and I share with many of you. If you still want to have some of these materials, let us know and I can forward it to him. Let's hear some humor. And I believe most of you know about Joe Wellness. And here we have Grandpa Wellness. And then the reporter was saying, researchers say vegetarians are deficient in protein, iron, calcium, zinc, and vitamin B12. What do you have to say about that? And then Grandpa Wellner said, maybe that's the reason we live longer. We don't need much of those vitamins. And by the way, those vitamins are rich in animal foods. And then Joe Wellness went to this guy that was putting the name of the person in a rice grain, and he asked, do you guys have brown rice? And then the food pyramid. Our food pyramid is becoming very similar to the original Egyptian pyramids, full of dead bodies inside, because they put the meat on the top of the pyramid. I don't understand. And this is our new restaurant in Loma Linda. Go for it. I'm nuts for it. McDonald's. Look at the menu. Almond smoothie, almond burger, Big McDonald, almond wrap, almond cone, almond cake, and no sugar added. I wish we have something like that. Now a question. Who is this girl? Yeah, this was Suzanne Abul Nazar. Suzanne Abul Nazar. Here is she, that graduate the last year. And who is this guy here? This baby here? You will never forget. This is me when I was a kid. In fact, I hate that picture for years because of that picture. Um, People always say, "Wow, you guys have a beautiful daughter." My mother should have cut my hair. And who is this guy? No clue. From Peru, Dr. Abel Alvarez or Abel Alvarez. And he sent a picture, and then he is one of the recent graduates of our program. So where are our graduates and what are they doing? Anuj Bhatia is Deputy Director of Public Health Service in San Diego County Health and Human Services Agency. He just contacted me a few months ago saying that he is doing well there and he is doing research, he is doing surveillance, and he is glad that he got his degree in preventive care. Kayona King is Associate Professor at the University of Nebraska Medical Center, College of Public Health. She is mostly doing research in health disparities. Miri Manzoor, also a graduate of preventive care, and then she is working at the volunteer services manager in the Jewish Home Life Communities Incorporation. So she is back in the Atlanta, Georgia. Let's move on here. And then Fiona Lewis, I believe she just, because I didn't have this update last year, she just moved to University of San Francisco, College of Public Health, and working as an associate professor in the Department of Community Health Sciences. Exciting to see our students getting positions, important positions in the academics. And that's it for now. Thank you very much, and I will see you on the next Preventive Care News at the second half of 2026. Thank you, and have a good time, my family, my Preventive Care family. Bye-bye.